4 gear, and that lets you save.
Look here.
True Form Life.
Green look on it.
Welcome to Exploring Mind and Body with Drew Tadia. Drew is an expert in nutrition, fitness, lifestyle, and more. And he wants to help you live a healthier, longer, and more active life. Now here's your host, Drew Tadia.
Welcome back to another edition of nationally syndicated Exploring Mind and Body. Thank you so much for being here. Thank you for tuning in and being a part of our True Form Life community, whether you're listening across the country on terrestrial or broadcast radio, or if you're listening around the world as a podcast. Thank you so much for tuning in. Today we're interviewing Dr. Candice Staniek, and she is a naturopathic doctor that takes a slightly different approach. Now, I think it's appropriate to mention that all types of naturopaths take different approaches. So there's a umbrella that holistic medicine or holistic care is under. Naturopathic doctors are one of them, and they all operate slightly differently. I'm super excited to have Dr. Candice on the show with us to talk about what she has going on. She goes deeper. She goes to the root of the issue. She goes to the emotional aspect or the root of exactly what's going on. So we're going to talk throughout the interview of how it's rarely surface. So if it's digestion issues that you're having, it's the root of the issue that she likes to get down and dig deep and figure out what's really going on. So I love this interview because it's not on the surface, especially when it comes to this holistic type of treatment that we're talking about. We really have to get down and dirty. We have to figure out what's going on and what's happening. So I hope you enjoy this interview. There's so much coming at you. Dr. Candice is coming from the Udaya Clinic in Red Deer, and they're actually a sponsor of the show. You've heard them before, and I really appreciate them being sponsors of the show, helping us out do what we do. And I know that she's going to be bringing you a jam-packed show of great information. So sit back and enjoy. We got all that coming up on...
This is Exploring Mind and Body. Naturally improve your lifestyle one show at a time with your host, Drew Tadia.
All right, welcome to another edition of nationally syndicated Exploring Mind and Body. Couldn't be more excited to have another amazing guest coming at you today. We have Dr. Candice Staniek here with us, and she's a naturopathic doctor. So without further ado, welcome to the show, Dr. Candice.
Thank you, Drew, very much. Looking forward to this interview today.
Yes, it's our pleasure. Super excited. We got so much to talk about. I want to jump right in here because we have a limited amount of time. Can you tell our audience who you are, what you do, just a little bit of background, and then we'll get into some more details?
Yeah, so I'm a naturopathic doctor. I was trained at Bastyr University in Washington State. I got into the profession after being questioned about how I was going to get promoted in the oil and gas industry, and I knew that that wasn't going to be a short stop for me. So I did further research and found that I was living the principles of naturopathic medicine and fell in love with the career.
Awesome. So you wanted to help people, I'd imagine, and most people get into these kind of things. Is that right?
Absolutely. And I found that the principles of naturopathic medicine in terms of a holistic diet, water, exercise, living a balanced life was something I was already doing, and I wanted to share that with other people.
So why was it more holistic or more natural as opposed to conventional medicine?
That's a very good question. And I would say, there's a lot of research around food as medicine. And, we know that eating holistic diet turns on and off genes. So that's just the basic foundations of health.
Yeah, I love that food as medicine. That's Hippocrates, isn't it?
I believe so.
Yeah, I think so. That one of our little mantras is food heals, food prevents, and food cures. And I love talking to holistic practitioners because we're kind of on the same path there when it comes to holistic healing.
Absolutely, 100%.
So you took your path to the holistic field. So when people come to you, in large part, what are some of the main reasons they come to you for to improve their health?
I would say some of the primary reasons people come the common ones being fatigue, weight loss, some digestive concerns, whether it's gas, bloating, cramping, constipation, diarrhea. Those would be some of the top ones. The conversations become interesting because that's the starting point for the patients. That's not necessarily the ending part of the conversation once I start asking questions.
Yeah, what's funny is I think it's Eckhart Tolle who I heard it from first, and he's like, whatever that main issue is, I think he was talking about more specifically like anger, like whatever you're angry about or whatever you think you're angry about, it's not the case. Like there's something deeper within. And I think you're saying the same thing when it comes to health. Like maybe they come to you for digestive issues, but there's a whole lot other things going on behind the scenes.
Absolutely. And it's very common that with my patients, I use something called applied kinesiology in my assessment program. And it's very common that I will start asking questions based on the findings of the applied kinesiology, and the patients are surprised. So, for example, if the lungs come up, in Chinese medicine, lungs hold grief. And so the patients are often surprised if I start asking questions about that because they didn't mention it in the intake.
Tell me what exactly applied kinesiology is.
Yeah, so it's a form of muscle testing. There's many different programs that people may participate in to get their training for applied kinesiology. Mine's pretty straightforward. I use indicators on the body, very specific points. I can identify parasites, viruses, bacteria, imbalances in the organs and glands.
So how do we know if we have we don't know what we don't know?
Yeah. So the body, when everything's operating optimally, the body is going to be in a strong state. If there's an imbalance in the organs or the glands, the body is going to go into a weak state when I indicate that part on the body.
All right. Okay. So when someone comes to you and they have some type of issue, they're not sure what it is, you can help through the questions and through the applied kinesiology?
Yeah. So I ask medical questions. I'm also try to be in a state of neutrality so that if there's any additional information that I'm open to questions coming in as part of the conversation. And then I'll use physical exam and muscle testing to identify issues for the patients.
Trueform Life.
Before we get into the show, I just want to mention Complete Truth Protein. This is a plant-based protein supplement that we've designed ourselves at Trueform. And the reason I designed it is because I felt like there was a need in the industry. Now, when I was traveling around the world, and I literally had a tackle box full of supplements and products and vitamins that did a whole lot more damage than good. So when I started doing more personal training and fitness classes, people would ask me what types of supplements I would recommend. And I always say, eat food. So that's why I've designed Complete Truth Protein around food. It's made with quinoa and hemp seeds. And one of the main benefits that it offers is improved digestion. So many of us deal with digestion issues on a regular basis. It also gives you a natural boost of energy. So if you head over to trueformlife.com/completetruthprotein, we have tons of more details, videos, recipes, and everything you need to get going in the right direction with a good quality protein supplement. trueformlife.com/completetruthprotein.
Trueform Life.
Okay, let's get into these details here. What is the physical exam?
So standard medical exam, going head to toe, skin, lymph nodes, listening to the heart and lungs, doing abdominal exam. That would be standard physical, of course, including vitals. The muscle testing, again, the indicators on the body for organisms, glands, and organs. And then any spiritual questions that might come that I will be prompted to ask the patients.
Okay, so how do you know if you can get a little bit deeper and ask these questions? Do you ask them, or is it a feeling?
It's more about a feeling that I get with the patients. I'm usually starting to gauge the patients right off the start with our conversations, and I can typically gauge where I can go with the questions. Or I will caveat the questions and say, this isn't a standard medical question. However, I think it's pertinent to your case. So if it's okay with you, I'd like to ask the question.
Are you able to share any of those type of questions you would ask?
Yeah, I had an example last week actually where a woman came in that she had gone to the hospital for an allergic reaction However, her symptom presentation wasn't fitting the criteria of a standard allergic reaction. And one of the things she had mentioned was that she had had hives, and hives are red spots on the body. And so I was sitting there thinking, well, what does red indicate on the body? And I had asked her, I said, is there any chance that you had some anger before this allergic reaction had occurred? And she said, yes, actually I did. And so we had gotten into quite a lengthy conversation of where the anger had stemmed from.
So tell me how can we get to like results? Like when you get a chance to get deep into the emotional aspect and talk to them or talk them through, how can we translate to showing the results that you've been able to see with your clients?
I think the overarching results are, patients starting to come back with new awarenesses that they didn't have before, or contemplating questions that we've talked about in my office, and they've had time to process it. Some of the other results being that, maybe they've had constipation and diarrhea for years and using over-the-counter medication, and within 6 weeks, they now have a life. One of my patients had constipation to the point where she was very uncomfortable going into Costco. And within 6 weeks, we had treated the infection. And she's like, guess what? And I'm like, what? She's like, I went into Costco and I went shopping. And I was like, that is so amazing, because for her, her constipation was inhibiting her life. It was debilitating.
So how do we put the two together? Like, I'd imagine that has something, like, without a doubt, I believe that has something to do with like the emotional aspect of going into Costco, for example. But what about when we look at people that are putting like hard to digest foods in their body, and it's the combination, I suppose. How do you address both of them? So even if you address those emotional issues, what if someone like continues to put like hard to digest foods in their body? They're not really living a healthy lifestyle. I'd imagine you'd have to put the two together to get the full results you're looking for.
Yeah, absolutely. And that often comes down to having conversations with patients. And one of the things I've recognized as a style that I practice in, I'm not afraid to ask questions of my patients. I'm not afraid to ask the difficult questions. I'm not afraid to go into the deeper questions. I'm not afraid to call my patients out when something's going on, to bring something to their attention. Because the fact is, if they want results and I'm working with them to have the results, we both need to have a collaborative relationship to have those results.
Are you still able to work with or help people that might not be so open, or would you direct them somewhere else?
I certainly can help people that are not as open. It's just a different conversation. And again, it has to do with my ability to be flexible and adaptable with people. So through my career that I had before in the oil and gas industry and finance, I did auditing, and I had to interview lots of different people at lots of different levels in the organization. And I've learned to be adaptable and flexible with a number of individuals. So I bring that into the office as well.
Sounds like very serious conversations you had to have in the past.
Sometimes.
It must be so different, like having that conversation, then moving on to like these conversations. Like, I want to...
Absolutely.
I'd imagine you enjoy these ones a little bit more.
Yes. I do.
Okay, so can you give us another example? I really like case studies, like someone comes into you with some other type of issue that may be, and maybe we can walk through that one. Like digestion is a big one that goes on. Maybe does someone ever come to you for like back issues or chronic headaches? These seem to be...
Yeah, so chronic headaches is another one. That's a little bit less of a conversation than, perhaps digestion or, skin conditions or something. Chronic headaches, I would typically look at diet and lifestyle as one of the components. However, I've been finding with my patient base that neural therapy, which is an injection therapy, is very successful, effective, and fast. Neural therapy incorporates procaine and homeopathic remedies and enables the body to reset. So it's like doing a reboot on the computer. So I've had patients come in that have been doubled over in pain, couldn't function, to reporting improved PMS symptoms, decreased frequency and severity of headaches, mood improvements, and appetite improvements. So it's pretty significant for someone, again, that has had debilitating migraines or debilitating headaches over time.
And what is that again? What kind of injections?
It's called neural therapy. So it was originates in Europe and was brought over to the States, and then some doctors in Canada use it as well.
So what kind of injections? Like where are they putting it? Where are you putting it?
Yeah, so for migraine type things, it's a subdermal injection, so it's just below the skin. And it is typically, I'll do a couple injections in the cervical region, and then I'll go paraspinal, so down either side of the spine.
And how often would someone have this treatment?
Yeah, so that would depend on the patient, but typically we'll do the first treatment. I'll have them come back in about 3 weeks. And then at that point, they're coming back 6 weeks to 2 months. And then it might be several months after that.
True Form Life.
Just want to take a minute to mention Complete Truth Protein again. This is a protein supplement that we designed at True Form. We believe in food. We believe food heals, cures, and prevents. That's why this product is much different than your conventional types of products. Unfortunately, packed with chemicals, preservatives, toxins that our body doesn't know how to utilize, digest, and absorb. So that's why Complete Truth Protein can help improve your digestion and will offer a natural boost of energy. You can find more details at trueformlife.com/Complete Truth Protein.
True Form Life.
So is this something that they would have continually, like work it into like every 6 months or once a year? Or would there come a point where like, oh, you don't need those anymore?
There could certainly come a point they don't need them anymore. Absolutely.
Okay. And is it is it just for like headaches, migraine kind of issues?
No, I've done scar treatments. So scars are known to have referral patterns, and the referral patterns are not medically delineated. So we don't know where a scar could be affecting another portion of the body. So I've done scar treatments of C-section scars, any other type of scars in the body. So knee pain has gone away, back pain has gone away, moods have improved. One of my patients have used it to maintain her waist circumference, and she's on some significant antipsychotic medications. So those have a tendency to increase weight around the waist. Another patient I saw had severe anxiety to the point where his wife had to attend a conference with him. He had injections, and immediately the anxiety disappeared.
Wow.
Yeah.
I think that's
pretty
a big
impressive.
One. Right. I think that's a big one, like anxiety and depression. Would you put those in the same boat?
I would to some extent. There's a lot of factors that go into treating anxiety and depression. I don't think it's so straightforward. And one of the theories I've been contemplating is, the potential of over-medication with those conditions when you consider heavy metals, foods, and environmental factors potentially creating the anxiety and depression as opposed to simply being a neurological issue.
So do you think that the injections could help with something like that?
Absolutely. Yeah, I have seen it help.
Okay. Have you tried it?
Have I tried? Yes, I've tried neural therapy and I practically jumped off the table because the lady who gave me the injections used multiple injections within about 5 minutes, and I wasn't quite ready for it. I don't use that many injections with my patients. I'm typically doing an injection every 1 inch. So it's not as many as I had. So I have to get it done. And I've also actually even used it for a dental infection. So intraorally, I've used it for shingles. It works amazing for shingles in terms of decreasing the pain, having the shingles go away more quickly, or having the shingles resolve. So I've seen amazing results with that as well.
So how does someone go about if someone's listening and they're like, oh, that sounds like what I need? How do they go and get that worked out?
Yeah, so they could phone our clinic for an acute appointment. I would do an assessment with them, ask them specific questions to make sure there's no contraindications, and then we would do the therapy.
Are they needles? Do they hurt?
Yeah, well, the needles are not comfortable.
Okay. Thanks for being honest with us. No, they don't hurt at all. Until you.
They're not comfortable. That's part of the treatment. And I think, the patient has to weigh, is it worth getting rid of this debilitating condition, for the pain? And all of my patients, for them, the ones that have debilitating conditions, yeah, they would take the treatment for sure.
Okay. So how could you use this and then some of your, how would you say, like deeper emotional conversations at the same time?
Oh, that's an interesting question. I don't know that I've had that present itself.
So those that are interested in this type of therapy, like they wouldn't be interested in having the conversation, or you just haven't had to do that yet?
I haven't had that opportunity yet to come up.
Okay.
Typically, I'm having more of the spiritual conversations, the deeper questions before the neurotherapy. However, it certainly can present in such a way that I'm thinking of neurotherapy right at the start with my patients.
Okay.
One of the things with the neurotherapy is, if people have had motor vehicle accidents or concussions, and those conditions take a long time for the body to heal, either because of the tissue or because of the damage to the brain with the concussion. And so when you look at neurotherapy and you're looking at how it resets the body, it can be a nice adjunct to what people are doing.
So would someone do this if they were just going through certain type of issues? Or can you use it in prevention?
I would say going through certain type of issues are already, the issues or conditions or symptoms have already started.
So you wouldn't be like, I don't want to have any emotional issues coming up in the near future. Can you give me some of these injections? Yeah,
no, that's not how these injections work. Other prevention I would suggest in terms of like whether it's herbs or nutrients or nutrition of some kind. However, not these injections. I don't see people lining up to get, needled.
Okay, just wanted to be clear on that one.
Yeah.
We haven't talked about nutrition too much, but I'd like to touch on it. What is your philosophy or mindset when it comes to nutrition? I know earlier you said that food is the medicine, and I'd love to hear you talk about that for a few minutes here.
Yes, so food is the medicine from the point of view of looking at how genes are turned on and off. Well, my caveat I'm going to discuss is I think people need to consider where their food sources, and they also need to consider the health of the soil of which the foods are coming from. A lot of the foods in the grocery store are shipped, from out of country, possibly other continents. So the ripening process is a consideration of how many nutrients are in the food. I'm typically would be recommending a minimum of a multivitamin with a lot of my patients just to bolster their food source. Or recommending B vitamins, fish oils, particularly in Alberta, where we're a landlocked province. A lot of people aren't getting enough fish, whether they can't find it or not available. So there's a little bit of, yes, food is medicine, and I also recognize that we have to consider where the food's coming from.
True Form Life.
I just want to mention Complete Truth Protein here once again before I let you go. This is a protein supplement we designed ourselves, made with quinoa and hemp seeds, also maca and stevia. We have 2 different types of products. They both have tons of health benefits. You can bake the original bag you can bake with. It's perfect for gluten-free flour. If you're celiac or gluten intolerant, we have tons of recipes on trueformlife.com. which include raw protein balls. People absolutely love these ones. We have pancakes, cookies, muffins, all healthy, all clean ingredients. Dorothy puts these together for us on a weekly basis. So if you head over to trueformlife.com, head over to the recipe section. We have all kinds of recipes on how you can use Complete Truth Protein. It's also a vegan and raw product. So if you have any intolerances or if you have any issues with digestion, this will definitely help you out. Once again, that's trueformlife.com/Complete Truth Protein.
True Form Life.
So when someone comes to see you, I know it's a broad question, but what are some of the issues they come with that can be addressed through nutrition?
Yeah, so depression, anxiety, nutrition would be, the fish oils and the vitamin D, right? That's just a basic kind of thing because the fish oils are nourishing the nervous system, and both those have neurological components potentially. As far as other nutrition, you're looking at energy and fatigue. So, is it a person eating 1 vegetable a day, or are they eating 5 or 6 vegetables a day? 5 or 6 vegetables, again, is going to be in much better place as far as support nutrition for the person than 1. So if I'm looking at their whole dietary component, I would be considering if they're nutrient deficient, even though they are getting some of the nutrients from their food, but maybe not enough nutrients.
So when you're looking at depression and anxiety, there's a direct correlation between diet. Is that what you're saying?
For sure, for depression, I would say absolutely. Vitamin D and the fish oils being some of your main components. Magnesium is also another component that can help with those. It's not always the case because, again, where is the depression stemming from? And then I get into the deeper questions if there's deep-seated anger that the person has that maybe hasn't been acknowledged. I can't just say yes or no to one particular thing, and that's where my conversations with patients start to get interesting and more holistic when I'm looking at physical, mental, emotional, spiritual that could be contributing to a particular condition.
I have to tell you that this one time I did a presentation, and maybe it was just the wrong room. And I was like, and I just briefly mentioned how food, like I'm very passionate about food, everything about whole food. And I said something along the lines of how food is linked to depression and anxiety. And people were like enraged. They were like so angry. I like handed out a newsletter list or an email list for people to like get some, like enter like a free prize. And people were like, a couple people like scratched their name on the list. A couple people left. And I was like, what's going on? I didn't think it was like I was offending anyone. I thought it was like more general knowledge. And people were like so upset.
Yeah, that's interesting.
Yeah, but what can you do? Yeah, but I believe 100% like that food is linked to most things that we can look at. But I really like how you go deeper in as well, because everything is emotionally connected to different areas of our lives as well.
Absolutely. Like one of the things I often bring up with my patients is just basic physics and chemistry. What is an atom? An atom is predominantly energy. So if we're like millions and trillions of atoms in our body, even though we look physical, how much is our body interacting with all that stuff around us? And so that's a component in what impression is our body getting from all those experiences. So I do bring in that emotional, mental, spiritual piece because it does at some level, whether we can see it or not, translate into the physical body.
There was something else you mentioned there that I liked, and you said that, are we nutrient deficient? Because a lot of times people are like, I hear this all the time. They're like, oh, I love food. And then I look at like their food picture and it's not food. I'm like, that's not food. It's like manufactured substances that have never grown in nature ever. So it was interesting how you said that people aren't food deficient. They're nutrient deficient.
Yeah, absolutely. Absolutely.
Yeah, many times we sit down and there's no nutrients in the, I'm using these air quotations, in the food that we're eating. There's no nutrients in them. So we think we're eating food, but we're not. We're not eating anything.
No, just filler.
Right.
Yeah.
All right, Candice, we do have to wrap things up here, but I want to give you a chance to talk to our audience here and let them know where they can find out more details. I know you guys have a clinic that you're excited about. Tell us what you guys offer and what you have going on. Yeah,
so I'm a co-owner of Udaya Wellness Clinic in Red Deer, Alberta. We have naturopathic services, neurotherapy that I talked about, counseling for individuals, couples, and adolescents, and we'll be bringing on some massage therapists in the near future.
Awesome. So they can get a hold of you there if they're interested in anything that you're doing here or anything that we talked about?
Absolutely. Yeah, our phone number, our website is Udaya Wellness at udayawellness.com. And then our phone number is 587-457-5669.
Awesome. Well, thank you so much for coming on. I love the conversation. It was great to have you on.
Thanks, Drew. Really appreciate it.
Trueform Life.
All right, that's going to wrap things up for this edition of Exploring Mind and Body. As always, thank you so much for being here. Thank you for tuning in and sticking around till the end. Hope you got something out of that interview. I hope you realize that we can go deep and find the root of the issue. It's not always the surface. In fact, it's rarely what's on the surface of what's really going on. If you're looking for someone like Dr. Candice to help out, she's definitely someone that could help out. If you're in and around the area, check out the Udaya Wellness Clinic in Red Deer. And if you're somewhere further away, you might want to give them a call to see where they would reference you to go to a better place or to help you out in different ways. So once again, thank you so much for being here. More details are going up on exploringmindandbody.com. This is where you can check out all past shows. If you want more details about what we have going on, that's at trueformlife.com. This is where we do meal planning, recipes, grocery shopping lists, at-home routines is what we do. We can definitely get you going in the right direction. Shoot us a message if you're interested or you need a little bit of help, and we'll get you set up with what we do. We also have a free app. Check out our free app on any Apple device. Search for Exploring Mind and Body. Download our app and take us with you wherever you go. Once again, thank you so much for being here. That's it. That's all I got. I'm out of here. As always, I'm your host, Drew Tadia, in health and fitness for a better world. Thanks for listening.
You've been listening to Exploring Mind and Body with Trueform Life's Drew Tadia, fitness expert. To find out more about the show, Drew Tadia, or to listen to past shows, visit exploringmindandbody.com.